Hi, I am Abhishek Arora and I am from Fastfame Multiverse. We are a marketing agency and we are exclusively working for dentists. So today we are at Dental Implant Clinic with Dr. Preet Kanwal. He is a very expertised dentist and we will have a very candid conversation with him today. Hi doctor, how are you?
I'm good.
Nice to have you with us.
Thank you so much.
So sir, I'll be asking general questions today.
Sure.
With you regarding this field in dentist and what your experience is about it.
Okay.
So my first question to you would be, how many times actually a person should be visiting the dentist in a year?
See, what we recommend is that every 6 months a dental checkup is mandatory.
All right.
The reason being that you as a person will not come to know of a dental problem unless it has progressed quite a bit.
Right.
Patients come to us with pain, the tooth has already gone in for requiring root canal treatment.
Right.
Bleeding from the gums, that is gingivitis. Teeth are shaking, that is periodontitis. So a dentist can judge and catch the disease much earlier.
Okay.
So that's why we recommend that every 6 months you should come for a dental checkup.
All right.
And at Dental Implant Clinic right now for almost a month now, starting from here for Diwali, we are giving free dental checkup.
Okay.
We are running a free dental checkup campaign.
That's very nice.
Yeah.
That is an incentive to you guys to definitely come and visit Dental Implant Clinic at Landmark Hospital as soon as possible. Sir, my second question to you would be, what is your recommendation for children? Because for dentistry, I mean, they are the most neglected ones.
Sure.
And what is your take on it? And if there's any specific thing which you want to suggest specifically for children?
Yeah. See, first of all, when should be the first dental checkup for the child? What we suggest is that the first checkup should be done the moment the first tooth comes inside the mouth.
All right.
Because any problem can be caught at the beginning. Secondly, patients come and ask, when should we start cleaning? You should start cleaning the moment the first tooth comes. How do you clean it? The parent has to do it with a soft towel.
Right.
Small towel, just dip it in water and it has to be cleaned twice every day.
Right.
Especially at night. And as the child grows, give him a toothbrush to chew on.
Right.
Initially he will just chew and make him stand next to you. He will look at you and start brushing. And there are certain toothpastes which are fluoride free,
right,
which are for the kids. So we recommend check up the moment the first tooth comes and start cleaning the day the first tooth erupts.
All right. I think these are two very important points which are highlighted.
Yes.
And these should be kept in mind always.
Yes. And another point I would like to say here is
Please.
that kids, they are very fond of chocolates, candies, toffees, ice creams.
Yeah, we all know that.
Yes, and we can't tell the child, you are not to have a candy at all.
Right.
There is something called wise use of sugar. So what that means is that the frequency has to be reduced. That means if a child wants to have it, keep one particular time, say after dinner, when the child can have chocolate or candies, and put the child into the habit of brushing afterwards. So all the negative effect of sugar goes off by this.
Well said, sir. I think these points not only help the children,
yeah.
These points also help us as adults,
yeah,
because we are also unaware about most of these things.
So reduce the frequency,
yeah,
and do it at a time when the child is going to brush immediately afterwards.
Yeah. So
at
what
night,
happens is
after dinner.
Got it. Sir.
Okay.
What happens is that in the hustle bustle of our daily lives, we usually neglect our dental health.
Yeah.
And what sir has highlighted makes us remind again that how important is our dental health for us.
Yeah.
So after this, I'll come to I'll ask you if you have some general suggestions to the public at large.
Sure.
And if you have a message to give to them, what would you like to?
Brushing twice a day minimum, and after meals. That means if you are brushing at night after dinner, morning, just rinse your mouth once with water, have your breakfast, and then brush.
All right.
And if you can, if you really have a high caries tendency, then we would recommend that you brush after lunch also.
All right.
So brushing at night after dinner is most important, because all that food particles which accumulate in the mouth, they will get converted into plaque and ultimately calculus, causing cavities as well as periodontal diseases. So brushing twice,
right,
once after dinner, once after breakfast.
Right.
That is one thing. Secondly, as far as possible, say in India, studies have still shown that the water level of fluoride is not up till the recommended level. So you need toothpaste which have fluoride in it, and fluoride is one chemical which has been shown to be anti-cavity. So
Very
use
right.
a paste which has fluoride. Yes. And in addition to it, a dental checkup every 6 months,
Yeah.
or as in when you have a problem. So
Right.
many times a patient comes, the patients will, or even the lay public tell us that we have sensitivity. So
Yeah.
see, sensitivity is a sign. The tooth is telling you something. It's crying out.
Yes.
So you have to not. So for adults, it should be a paste which contains fluoride. Fluoride
Alright.
is a chemical which has been shown to be anti-cavity.
Absolutely, sir.
Yes.
Absolutely. Other than that, sir, I would also like to ask, what should be the recommended time for how long should a person be brushing their teeth? What
Yeah.
is because there are so many.
Yes. See, ideally 3 to 4 minutes.
Okay.
For brushing time. Usually, what people will do is just 20 seconds, and
Yeah.
they feel that they've done the thing. And there is a particular technique for brushing also. And there is not one technique, there are multiple techniques. Usually we recommend a certain technique, but for certain people who have pyrrhia, who have spaces in the teeth, we have different types of techniques. So best will be the dentist to demonstrate that technique to you,
All right.
and then follow that properly.
Yeah, I think that's the right course of action. Very well said, sir. So the next question I would like to ask is, so people these days are usually scared to go
Yeah.
to a dentist because they have certain apprehensions.
Yeah.
How much would be the charges and how long would it take and would it be painful or not? So if there's anything you would like to say on this.
I think you hit the nail, hit the hammer right at the nail at the right spot, because I think there are two deterrents as far as a person coming to a dentist. One is pain, the other is money. See, as far as pain is concerned, nowadays with newer technology, modern techniques, all dentistry is painless. At the most, the only pain you may feel is because of the needle when we are giving local anesthesia shots. That also we use very, very thin needles. Patients sometimes are scared, but when we actually give the injection, they say, "Ho bhi kya? Are? Achha, okay, it's one." Secondly, as far as money is concerned, see, of course, in Dental Implant Clinic, both the centers, we are conscious about this, and we try to be pocket friendly and keep the charges as minimal as possible.
Yeah, absolutely nice. Thank you.
And also, a stitch in time saves 9. People will postpone the treatment and then end up paying much more. A normal cavity becomes a root canal treatment. A root canal treatment ultimately becomes an extraction or implant, if not treated the right way.
That's a fact, sir.
Yeah, one should visit and get it done at the earliest.
Yeah. Other than that, sir, I would like to ask you, what is the USP of Dental Implant Clinic?
Yeah.
I mean, what is something which gives this clinic an edge over other clinics of Chandigarh?
Yeah, see, multi-speciality approach. I'm an oral surgeon. We have Dr. Shanam, who's a periodontist. We have Dr. Vasundhara, who's again a specialized aesthetic dentist. We have Dr. Karen, she's an orthodontist. Dr. Akanksha, she's an endodontist.
So you're a team of how many people, sir?
5 doctors.
All right.
Plus, in the Landmark Hospital, we also have backup of the medical side also.
All
Say
right.
somebody needs a consultation from a medicine person. Or
Certainly.
somebody. And we have OT facilities, general anesthesia. Children who are not cooperative on the dental chair, we can give them short general anesthesia, do the treatment.
All right.
So that way, all modern facilities
And high-tech
under
machinery.
high-tech machinery and pocket friendly.
All right. All right, sir. Last but not the least, I'd like to ask you, how does the dental health of a person affects his overall general health?
Yeah. See, nowadays there are studies which have actually proven that poor oral hygiene affects the general health of the person. There have been proof that cardiac diseases, heart diseases, diabetes, obesity, all kinds of diseases are there because of poor dental health.
Right.
Secondly, if a person loses one tooth or multiple teeth, they're not able to chew the food properly.
Right.
So that will affect their digestion, ultimately their nutrition.
Yeah.
So definitely dental health has a direct relation with the general health of the person.
All right. That's it, and that very nice to have you with us, Dr.
Yeah.
Preet, and it was a nice time talking to you. Thank you.